you're a parent, you know that sound, that late-night snoring or stuffy-nosed breathing coming from your child's room. It can be so worrying. Well, today we're going to dive into one of the most common reasons behind it all, enlarged adenoids. This is about so much more than just snoring. So does this sound familiar to you? Is your child a really noisy sleeper? Do you notice that their mouth is almost always open, just to breathe, even when they don't have a cold? These are the kinds of signs that make parents start searching for answers, and you're in the right place. So what's really going on here? Well, in a lot of these cases, the culprit is something called enlarged adenoids. It might sound like a complicated medical issue, but the idea behind it is actually pretty simple. Let's break it down. Okay, the official medical term is adenoid hyperplasia. That's just a fancy way of saying that the adenoids, which are just a little patch of tissue way up in the back of the throat, right behind the nose, have gotten swollen and too big for their space. And here's a really key point. Adenoids themselves are totally normal. They're part of your child's immune system, kind of like little guards. The problem only starts when these guards get so big they actually start blocking the path, in this case, the airway. So why do they get so big? It's usually because they're just working overtime, fighting off one infection after another, or constantly reacting to allergies. We see this most often in kids between 3 and 10 years old. But here's the good news. For most kids, this tissue naturally starts to shrink down after puberty. All right, when those adenoids are too large, they can set off a whole domino effect of symptoms. Let's walk through the big signs you might be noticing at home. First, let's talk about the nose. This is probably the most obvious stuff. Because that airway is blocked, kids have no choice but to breathe through their mouths. That leads to that loud snoring at night. You might also notice their voice sounds kind of stuffy, almost like they have a permanent cold. That's because air can't move through their nose properly when they talk. But the problem doesn't stop at the nose. It can actually move over to the ears. See, the adenoids are located right next to the eustachian tube. That's the little canal that keeps the middle ear clear. When the adenoids swell up, they can block that tube, trapping fluid inside. This is a classic recipe for recurrent ear infections and can even cause some temporary hearing loss, which, as you can imagine, can really affect how a child does in school. And beyond the nose and ears, enlarged adenoids can affect the whole body. All that blocked breathing leads to really restless, poor quality sleep. In more serious cases, it can even cause something called obstructive sleep apnea. That's when a child actually stops breathing for a few seconds at a time while they sleep, which is, of course, really scary. Plus, all that post-nasal drip can trigger a nagging cough or even chest infections. Now, here's something interesting. When a child breathes through their mouth for months or even years, it can actually change the way their facial bones grow. Doctors have a name for this look, adenoid facies. It's a very distinct appearance, a constantly open mouth, a slightly longer face, and a kind of pinched look to the nose. It's a major physical clue that there's been a long-term breathing problem. So if you're nodding along and recognizing these signs, you're probably thinking, okay, what now? Well, the next step is getting a proper diagnosis, and thankfully, the path to getting answers is really clear. The whole process starts with you just talking to your doctor, telling them about all the symptoms you've been seeing. To actually see the adenoids, the best way is a quick look with something called a nasopharyngoscopy. It's a teeny tiny flexible camera that goes through the nose for a direct view. It's super fast and gives the clearest picture. Sometimes a simple X-ray from the side can also do the trick to see just how big that blockage is. Okay, once it's confirmed, the conversation shifts to making things better. We're talking about treatment, and there are some really effective ways to help your child breathe easily again. And it's important to know, surgery isn't always the first answer. Usually, doctors start with medical management. The goal here is to treat the root cause, so managing allergies or clearing up any infections. This can involve simple things like nasal saline rinses. A doctor might also prescribe a corticosteroid nasal spray. These are great because they work right on the swollen adenoids to shrink them down. But if the blockage is really severe, or if these treatments just aren't enough, then surgery to remove the adenoids, called an adenoidectomy, is the most direct and permanent fix. Now, I know the word surgery can make any parent's heart skip a beat, but a modern adenectomy is really different from what you might be imagining. It's minimally invasive, and it's all done through the mouth, so there are absolutely no cuts or scars on the outside. Often, it's a daycare procedure, meaning your child can go home the very same day. And modern tools like something called coblation gently dissolve the tissue, which means it's practically bloodless. It's truly considered a very, very safe way to solve the problem for good. So after treatment, what happens? What does a healthier future look like for these kids? This is the best part, because the positive changes are huge.
The results can honestly be life-changing. The snoring just stops. Those scary pauses and breathing at night, gone. This all leads to better, deeper, more restful sleep for your child. And let's be honest, for you too. And when a kid is sleeping well and getting plenty of oxygen, it makes a massive difference in their overall growth, energy, and development.
When you think about the impact on sleep, on hearing, on school, even on how they grow, it becomes so clear that this is way more than just a snoring problem. Taking care of it isn't just about fixing breathing. It's about giving your child the foundation they need to really thrive. So the real question is, could better breathing unlock your child's full potential?